Welcome to Healthcare Foundation of LaPorte's 10-20-30 Building a Custom Dashboard tutorial. To begin, Healthcare Foundation of LaPorte's mission is empowering LaPorte County residents to live healthy and well. Our vision is to be among Indiana's top 10 healthiest communities by 2030. 10-20-30 is the central hub of information for LaPorte County, Indiana, with the most up-to-date data, and it is Healthcare Foundation of LaPorte's first gift to the community. What is a dashboard? A dashboard from 10-20-30 is a dynamic tool that visually represents data points in a panel. Think of it like a graphic snapshot of indicators or key information you would like to track. Dashboards can help communicate goals and progress visually. In this tutorial, we will explore some existing dashboards on the site, provide step-by-step directions to search for and save data, explain potential uses for custom dashboards, and discuss additional customization options. Let's get started. On the home page, we will see the first navigation link, Explore Data. If we click on All Dashboards, we will see a variety of created dashboards, including the HFL Priority Tracker. The HFL Priority Tracker contains all of the indicators that HFL tracks for its strategic priorities. Keep in mind that the Priority Tracker is a very large dashboard and contains many indicators. Each of these rows visually tracks one of HFL's key indicators. Let's look at the second row, babies with low birth weight. This one is one of our healthy children indicators. The first piece of data is the value, 8.9%. This means that 8.9% of births in LaPorte County were babies with low birth weight. The number under the value, 2020, in parentheses here, is the year for the data and is the most recent year that data for the indicator is available. To the right of the value, the indicator has visual elements or icons called gauges. These gauges show how LaPorte County compares with other counties in the state. In the first gauge, the needle in red means that LaPorte County is in the bottom 25th percentile, the worst percentile. This means that 75% of Indiana counties have values for babies with low birth weight that are better than LaPorte County's value, which means fewer babies in those counties are born with low birth weight. The second gauge, with the red arrow pointing up, means that LaPorte County's value for babies with low birth weight is higher than the comparison value of other communities in the state of Indiana. And the third gauge shows that the county's value is higher than other communities in the United States. The next gauge represents a comparison to the prior value, so the prior year that is available. In this case, it is 2019. The triangle pointing up means that the value of 8.9% is higher than the previous year. The far right gauge shows that this data point is trending down or improving, as signified with green and the down arrow. There's a useful help article on gauges that you can refer to if you need a gauge refresher. You just simply click on the blue help button here, and then you can type in a keyword. So gauge, for example. And this will bring up several results, several articles. The gauge and icon overview provides a quick overview. Now that we've seen a dashboard example and understand the different types of gauges available, let's build our own custom dashboard. To do this, go to the navigation bar and select Build Data Reports, and then build a custom dashboard. First, we need to decide how to select indicators. One option is to filter indicators by locations, comparisons, subgroups, or sources. Another option is to select specific indicators, which is called hand pick indicators on 10-20-30. We can tell that we're on the hand pick indicators here by this hand and select indicators. You can toggle between different options like filter by locations, topics, populations, etc. by clicking over here, hand pick, filter. So we're going to stick with hand pick. Let's imagine that we want to track LaPorte County residents' access to healthcare. We can easily create and save a custom dashboard for healthcare access. First, we need to select the indicators we wish to include in our dashboard. Click on the box that says Select Indicators and simply type in a topic, or if you know a particular indicator name, type that in. We can also scroll through the list of available indicators. For example, scrolling through the list of different indicators, or we can type in a keyword. So for our dashboard, let's type in the keyword access. And this immediately brings up health, healthcare access, and quality. So we have related indicators and categories here for our dashboard. Since a big part of healthcare access is having insurance, let's select adults with health insurance. So we have adults with health insurance, 18 to 64. And then let's also select children with health insurance. Let's see what else we have here. Providers. The availability of providers is also a big part of healthcare access. So let's select that as a third indicator. And for our last indicator, how about adults who have had a routine checkup? We can select as many or as few indicators as we would like, but we're going to start with these 4. Okay. After we select the indicators, we can choose how they will be displayed. In this case, as we come down here, we have our indicators and we can select how they will be displayed, either group by indicator, group by location, or indicator location summary. Let's leave it at group by indicator for now and see how that turns out. So let's click search. And here we can see that the dashboard has been created for the selected indicators. Adults who have had a routine checkup, and all of these, my goodness, census places, zip codes. We scroll down, lots of information here. Adults with health insurance, children with health insurance, and primary care provider rate. Looks like this because this indicator, children with health insurance, is only available at the county level. Same with this one, primary care provider rate, only available at the county level, along with adults with health insurance ages 18 to 64. But for our first indicator we selected, adults who have had a routine checkup, that is available, it looks like, at the county level, census places, and then also zip codes. This is a lot of information, so let's change the filter to get this looking the way that we want it to. So let's go back up and let's filter by locations. If we put in a location, it will specify. We know that 3 of the 4 indicators are just available at the county level, and really we're interested in seeing this information for LaPorte County. So we will select LaPorte County there. And then let's click search again. Now that's better. Now we have our 4 indicators and we have each row with the values and the different gauges. Now let's save our dashboard. Above the dashboard, we see a red link titled Save a Link to This Search. We click that. The URL or link will automatically be copied for us. We can paste that link into a document for safekeeping to use in a variety of ways, which we will touch on in a moment. We can also, this is already here, we can just copy this link, but we can also bookmark it. So in Chrome, we can bookmark it by clicking on the star and then selecting the folder or location we'd like to save it to. I already have this bookmarked in 10, 20, 30 examples. Another thing to note is the additional data available. If we click on an individual indicator or row within our dashboard, like adults with health insurance, for example, if we click here, we can see expanded information on that indicator. We can see the measurement period. We can see the definition of the indicator. We can learn why this is important, and then we have access to charts and additional information, as well as the original data source. This additional information can be used in reports, presentations, or grant applications. A note on dynamic updates. Any dashboards that we create and save are dynamic, meaning as the data updates on the site, the data will also update in the dashboard. This means that we will not have to edit our dashboard unless we choose to add or remove indicators or edit our filtering. Next, we have a quick review of our custom dashboards. Remember, we can create a dashboard by clicking on the Build Data Reports link in the navigation bar, then selecting Build a Custom Dashboard. We can also use the Build a Custom Dashboard button on the home page next to the Explore Data search bar. Once we've created our dashboard, we click on Save a Link to this search, and we can paste the link into a document for future use, or we can also bookmark our dashboard. Let's discuss uses for custom dashboards. Saved custom dashboards can be used in a variety of ways. You can link to it in a presentation, send the dashboard or the link in an email, include the link to the dashboard or an image of the dashboard in a grant application, and even embed the dashboard on your organization's website. If you have other ideas for using your dashboard, please share those ideas with HFL. We hope this tutorial will help you build your own custom dashboards. Please contact us if you need additional help or if you have questions about the data available on 10/20/30. Click the Contact Us link, the Get Involved drop-down menu, or reach us by email at contact@hflaporte.org or by calling us at 219-326-2471.